Let's just get a little insight on the Covax facility progress, and we speak to Sophie Mokoena, who is, rather not Percy Mokoena, I beg your pardon. It's a Friday. Sophie Mokoena, who is SABC News foreign editor, to talk about this development. Sophie, firstly, what do you make out of this announcement and the progress that has been made?
I think the stakeholders on Covax facility were trying to assure the world that all is well and they are on track to ensure that the poorer countries are able to access vaccine. You know that there was a story this weekend, a leaked report that it looks like Covax is facing challenges because those countries who have made commitment are not paying, and therefore there was fear that the Covax facility will not be a reality. So when I look at the body language and questions and the presentation, because I have been following Covax since it was launched, I am aware that this was a way of ensuring the world that the process is still on track. But I think the most important issue for me was the AstraZeneca and Johnson & Johnson giving an update in terms of the processes with their trials. We know that there are trials that are being conducted in South Africa by Johnson & Johnson. And there was a question that we saw a story this week indicating that Johnson & Johnson has requested an approval from the regulatory body in South Africa to make this vaccine available. And responding to that question, the representative from Johnson & Johnson indicated that it is not only directed at South Africa, they have done this with many other countries where they have conducted trials. Because what we must know, as you have pointed out, that these trials are happening worldwide in all the regions. And Africa, it's just one area where trials are being conducted, but majority of the trials are in Europe, in America, in Asia, and therefore Africa indeed is participating very few countries from the African continent. Out of the 50 trials that are currently underway around the world, you only have, I think, 3 or 5 on the continent, and therefore it is not the majority, and therefore Africa is not being used as a guinea pig for trials. And also UNICEF giving an indication what they are doing, because we tend to focus on adults and we forget that there are children who are supposed to be taken care of, and UNICEF giving a briefing there in terms of what they are doing to assist children also to have access to the vaccine, but also to ensure that they are protected, because we tend to label them as the spreaders of this virus, but we don't really look at what we are doing to assist them to be part of the solution. The other important issue, WHO indicating that they are not going to cut corners, emphasizing the fact that all the processes will be followed to ensure safety and to ensure that the vaccine results are good. And therefore, this is an issue many people have been asking, whether are we going to ensure that these vaccines are safe. You know, the current talk in South Africa, where people, some, not all of South Africans, raised concerns around what the Chief Justice has said. Here, the WHO giving a guarantee that, as they do with other vaccines, they will ensure that proper health protocols are followed before these vaccines are available on the shelves. And Gavi emphasizing that they have allocated a lot of money to ensure that poor countries are able to access vaccine, but also making a call to the rich nations, particularly the G7 and the G20, that it is of no use to pump these stimulus packages to revive the economy when you don't have a vaccine or you don't have a program that will ensure that you deal with the pandemic, because you are just wasting money, because people will be infected and you'll continuously have a problem of COVID-19. Therefore, it will be proper, or it will be better for these rich nations to contribute to Covax so that you are able to manage the disease, because no one is safe until all of us are safe. And I think this is the message that President Ramaphosa has communicated to the G20 member countries, as South Africa is the only African country that is represented in the G20 group, where he also made a call to the G20 to look at investing in the vaccine and making vaccine available to the poorer countries, because we live in a global village. If all of us don't have access, no one is safe. And today we saw Mike Pence, the Vice President of the United States of America, receiving the vaccine. And we see these visuals in Europe, in America. And here we see a stark reality of the issue of inequality. Others are getting vaccines, others are not. And we are told that we have to wait until next year. This is an indictment on the United Nations, but also on the developed nations like the G7 and the G20.
Well, you've summed it up, Sophie, especially with now talking about the issue of misinformation regarding the prayer of Chief Justice Mokoena. But also one talking about equitable access, very briefly there, Sophie, concern regarding countries that are rich and that are poor. But then when we look at equitable access within the countries themselves, you would find that there is a variation in terms of the rich and the poor also having access to basic health care, and how they would be able to access these vaccines if they are allocated equitably.
Yes, I think the issue of having access to health facility is a critical issue in the world. I think normally we tend to focus on the economy. If your health systems are not in a good standing, that will affect the economy. The developed nations, much as their health systems were up to the task or were of a good standard, the other important issue is to ensure that your population are able to understand the do's and don'ts of health protocols. But also what one can talk about, particularly from the African continent, the WHO always emphasized the fact that Africa is having small numbers in terms of infections, even though South Africa has got a high number, because we tend to involve the communities and healthcare workers who are on the ground, who are involved in the communities, are very critical. And therefore, investing in the primary healthcare, where you deal with stopping the infections. You don't deal with you deal with the problem before it starts. You don't treat. You deal with the symptom. You don't deal with the treatment. Now, the developed nations, even South Africa, our healthcare system is focused at addressing the problem when it has happened. And therefore, countries such as Cuba are giving us an example of how to deal with healthcare. Start with prevention. Don't allow the diseases to spread, because when there's an outbreak, it will be a problem to control it. And I think around the world with COVID-19, we have learned many lessons, and therefore we have to learn from each other. But what is critical is to ensure that we work together as a global village. In other words, the rich, the poor must work together, because if the rich have access to facilities, it doesn't mean that they will not be affected, because if the poor don't have access to facilities, they will spread the diseases, and therefore the whole world will be affected. I think in 2021, the leaders of the world, be business, politics, churches, individuals, all sectors, we must preach unity, working together as a globe to address the challenges facing the world, be it economy, education, health, crime, everything. We have to work together because no one is safe until all of us are safe.